Okay, I'm really looking forward to the next session. I know all the other speakers today are really important, but we have somebody who I think is going to really challenge us today on a topic of well-being, and that's Professor Sir Cary Cooper. We're really pleased you can join us, Cary. Most people will know Cary because when I get the media updates each day about the university, it's 10 times more than Brian Cox does Cary feature in popular media. And from a social responsibility perspective, that role of being a public intellectual, not just talking to ourselves in top journals, but really reaching out to people through radio, through television, through the written press, is a really important feature of your work, and that provides so much value to the university more broadly. For people that don't know about Cary, he's the 50th anniversary Professor of Organisational Psychology and Health at the Alliance Manchester Business School. He's President of the Chartered Institute of Personnel and Development. That's the HR professional bodies, I'm sure you know. He's the immediate past President of the British Academy of Management and President of the Institute of Welfare. He's the author and editor of over 170 books on well-being, on productivity, on happiness, on middle management, on stress, on health, and he's the editor of the 6-volume Wiley-Blackwell Compendium, Wellbeing. And he's also produced over 350 scholarly articles on organisational psychology and HR topics. He's got 7 honorary doctorates and is honorary fellow of the Royal College of Physicians, just to add that in there as well. He's the first port of call by the national international media on workplace health and well-being. He received a CBE from the Queen in 2001, so he was knighted for his contribution to occupational health in 2014 and his contribution to the social sciences. Just this morning, you said you were on the radio, on 3 different radio stations as he arrived. So between arriving this morning and wanting to listen to Patrick's talk, he was on the radio 3 times. So I think we're really privileged to have you here, Cary. We're really looking forward to what you do. And also, this is going to start a conversation on well-being, which Cary will explain at the end of his presentation. So give him a warm welcome, please.
You're not going to have any trouble with my Mancunian accent, are you? No problem at all. This is not July 4th. I should have been doing that. I was down in London yesterday and got called about July 4th by the media. What I was going to talk to you today is well-being. What is it? Why is it so popular now? And it really is very, very popular. I have a university spin-off company, University of Manchester spin-off company called Robertson Cooper, right? We've been going since 1999, and now we're booming. We thought we were going to disappear during the recession because it was kind of a nice to have, but now it's a must have. Let me show you why. So what I'm going to do is highlight the costs of lack of well-being in the workplace and why organizations are really into it. Then I'm going to highlight what causes lack of well-being or enhances you in the workplace. And as like any good academic, I won't tell you how to sort the problem out. None of us ever do. We just highlight the issues. Okay, let's go for it. This was the first time in 2015, the CIPD, 150,000 HR professionals of which I'm president. This is the first time that musculoskeletal illnesses, i.e. backache and the like, were not the leading cause of sickness absence. The leading cause of sickness absence is now stress and mental ill health. Okay, what we call the common mental disorders of depression, anxiety, and stress. Absolutely the leading cause now. And if you take a look at this is this last year, 2018. This is the HSE, Health and Safety Executive. Don't look at every detail. It's a funny little round one on the right-hand side. 57% of all sickness absence in the UK is due to stress, depression, and anxiety. That's massive. And only 25% due to musculoskeletal, i.e. backache and so on. It's a really big issue. This one shows that work-related stress, just in 1 year, 600,000 people, 2018. It's not a good news scenario. It's good for me because my books on stress are selling really well. So you're managers, so keep it up. All right? By the way, there are lots of copies of my book out there which I can sign. No, they're not. Anyway, but here's something interesting. Stress isn't just the issue or depression, anxiety, and all of that. What's also a problem is what I call presenteeism. Do you know what that is, many of you? Okay, let me tell you what it is. And you know how the term started? In the 1980s, we had a recession. I got phone called by a major newspaper saying, Cooper, want to ask you a question. Why, we're right in the middle of a recession, are the stress-related illnesses dropping? Why is our sickness absence rates dropping? I said, I'll tell you why it's dropping, is that if people have just been made redundant, and a lot were in the 1980 recession, not as much as the current one we had, if you're ill, what are you going to do? Are you going to stay off ill? No, you're going to go into work, aren't you? So the issue, in other words, you're job insecure, because everybody was job insecure during the 81, just like the last one, but the last one was even worse. So you're going to get, instead of absenteeism being an issue, for some reason it came into my head, presenteeism an issue. From then on, there's been tons of research on this as a topic. It's interesting. And it's basically not just you going to work ill, it's also you going to work job dissatisfied. In other words, you're present. You're showing face time, right? But you're delivering no added value, right? Because you're job dissatisfied, leaves on the line, pray to God, anything to get out of work, because you're not happy and everything else. So, but here's interesting. So the first time, just before the recession in 2007, the economists, top economists at the Sainsbury Center for Mental Health found that presenteeism, we now measure it, by the way, was double the cost of absenteeism, which scared people. It's a worry because it's hidden. People are there. They're showing FaceTime. Their bodies are there, but they're not delivering. Right? And that is a bigger worry. Absenteeism, at least you know what the issue is. Now, you're all clever people, so I'm going to ask you something in a minute. Take a look at this diagram. So basically what we want at Manchester University, what we want in all our businesses throughout the country, is we want healthy and present people. Right? Motivated, healthy and present people. We get sickness presenteeism, frequently going to work because they're frightened of getting on their HR record. We know about that. We have healthy and not always present. These are people who are job dissatisfied. They're healthy, but I just don't like my work, right? And so therefore they find any excuse not to do it. And we've heard all these excuses about trains and everything. There's a little bit of, it's 25 degrees, oh God almighty, the heat, it's melting the things on the tracks on my way to work, I can't go, anything to get out of work. And then unhealthy and always present. Now, I've done a study of 39,000 people in the UK on presenteeism, okay? So what proportion of people do you think are paying my pension and your pensions, that is, are healthy and present in the workplace? Shout out a percentage. Out of 39,000, just a percentage. Come on, up it. 46. Okay, that's pretty specific. 46.57. Okay, let's go. Anybody else? 20. Okay, that's a pessimist over there. Do we have any bidding upwards or what? 60. 60. Who said 60? You did? Okay, so you're the optimist, right? So only a third of you buggers are paying my pension and will pay your pension. Isn't that horrible? 1 in 3. And therefore you wonder why the UK is 7th in the G7 on productivity per capita and 17th in the G20. Not good news. Also, there's other factors too, which I'm going to highlight in a minute. So that is something we should worry about. I'm just throwing this out. Anybody wants these slides, they can have them. The worry one for me is the top one. The OECD, look at every OECD country and look at the whole issue of mental health and what it costs the workplace, 4.5% of our GDP, right? Our bloody GDP is only at 1.375. So what if we just hit a third of that and added it to our GDP? Would be useful, wouldn't it? So that's a problem too. But these are the costs. That's Sainsbury Center for Mental Health, Office of National Statistics. It's a big issue. Okay, now, I shouldn't say this as an academic, but to be honest with you, and I do a lot of work with the health and safety executive and the European equivalent and things. So this is what we found are the major causes. We don't need any more research on what causes people to get ill at work and what are the motivating factors. We know it. The evidence is clear. The issue is, how do we action it? How do we have the right policies? How do we do the right auditing? And I'll explain how you do all that stuff. Okay, so the factors are factors intrinsic to your job, the role you play, your relationships. I'm going to go over each one of these. All of those factors on the left affect you and affect whether you get individual symptoms or organizational symptoms. When I'm called in by a workplace or a professional body or a government department to do a well-being audit and to find out what the hell's wrong, I'm called in for those factors at the bottom. High absenteeism, high labor turnover, poor quality control, accidents, things that hit their bottom line, or being sued. because, people can report their employer to the HSE, the Health and Safety Executive, and then they issue an improvement order on the organization, like they've done it on 2 hospitals. So it's a real problem. And the model just says if you don't deal with the problems on the left, then you get the problems on the right, right? Individual disease or organizational disease. And then there's a box that's 6 foot long and goes 6 foot down. And that's the end of the stress process. The important thing for us in the workplace, listen, you're all managers. People look up to you. You determine their health and well-being. You don't think you do, but you do. More than you think, believe me. And so we have to understand these factors that cause people, that can make people thrive or make them stressed. So too much work, too little work, in universities, of course, people are always overloaded. We've got a lot on. We're trying to keep our labor costs down, but all organizations are doing that. That's why I think the issue of well-being is come to the fore, because we're just mean and lean now. We had fat before the recession. There's just no fat now. Oh, I can see it in universities. You see administrators, managers, in trouble. Too little work can be a problem too, by the way. And that can be a problem because you might not have enough to do, and maybe your boss knows you don't have enough to do. Listen to this. You remember something, I don't know if you remember Catch-22, the book? In fact, there's a new film, isn't there? The guy who wrote that is a guy called Joseph Heller. He wrote a fantastic book. That wasn't his first book. His first book was called Something's Happened. Anybody read that? Oh, you got to read it. It's wonderful. It's about a guy working in an insurance company who has a stress breakdown. And it's comical like Catch-22, but pretty powerful. Listen to this. This is a character who has not much to do. He says, I am bored with my work very often now. Everything routine that comes in, I pass along to somebody else. This makes my boredom worse. It's a real problem to decide whether it's more boring to do something boring than to pass along everything boring to somebody else and have nothing to do at all. It's really a lovely book. So underload. Every job, academic, has a stress profile. A manager in a higher education institute will have, like you guys, will have a stress profile. We will know what the characteristics are of your job, which can put excessive pressure on you. So, for example, I did one of the first studies I ever did when I was at UMIST was all the air traffic controllers at Manchester Airport. So I fly out of East Midlands now. Honest to God, and it was pathetic. I was taking a PhD student of mine to do the interviews, and we were taking blood chemistry. We're doing a proper study of all the air traffic controllers. We were doing it for the union and everything else, and we were measuring their coronary risk at that time and everything else. I'm taking the guy over, and the head of the air traffic controller says, that's the guy you're going to interview. He's 15 minutes to go on his shift. Just stand behind him. He turns around, he has 2 cigarettes in his mouth. I'll never forget that. I thought, oh shit, what have I got myself into here? Anyway, that's a stress profile for air traffic controllers, okay? Interestingly enough, one of the things we later found out was also the thing that stressed them is twice a year they have to go to the CAA doctor, Civil Aviation Authority doctor, to be examined. And if their physical and mental health isn't good, they lose their job or suspended until it gets better, whatever it is. So that's a pretty big stressor. How would you like to go every 6 months to be looked at by our occupational medic here? Okay, the role you play, how much control, autonomy you have in the workplace, I think is a pretty kind of fundamental thing too. So there's so much research on this. The more you feel you have control and autonomy and you're let to do what you want to do, the better. I think that is a kind of problem in university. I think most universities are pretty command and control. We're very hierarchical. I don't think when we manage people, we give them the kind of autonomy they need, right? But I think that's partly I know among the academic staff, it's partly a function of who we get to manage a department. And that's another story I don't even want to get into now. I think I've talked to Patrick about that. But all universities here, it's Buggin's turn when you're an academic. You have to, Cooper, you're going to take over. When I was at UMIST, they came on, I was a professor, a young 34-year-old professor, and they said, Cooper, you're going to have to take over in 2 years' time to manage the school. It was a big school. I said, what? I'm just a professor. I want to get on with my research. Oh, no, it's your turn now. Okay? How long do I have to do it for? 3 years. Oh, my God. Luckily, I appointed somebody who was a great administrator, and she did 89% of the work. It was great. Anyway, the role you play, the control you have over it. Listen to Heller. I love this. Is a guy, a middle manager in a company who doesn't have any control. Says, what would happen if deliberately, calmly, with malice aforethought and obvious premeditation, I disobeyed? I know what would happen. Nothing. Nothing would happen, and the knowledge depresses me. I suppose it's about impossible for someone like me to rebel anymore and produce any kind of lasting effect. I have lost the power to upset things that I had as a child. I can no longer change my environment or disturb it seriously. They would simply fire and forget me as soon as I tried. So the issue of control, I think, is important. How do you let people have their headspace to do what they want to do and challenge them? This is looking at role. I did a big study for the BDA, British Dental Association, and I did a really lovely one for the California Dental Association. They called me up in November, a number of years ago, and I was in my UMIST office, and they called me up and said, this was November, middle of November, saying, Cooper, this is University of Southern California Dental School, the California Dental Association, I want you to come over and do a study of California dentists. Very high suicide rates among dentists at the time, high stress levels. They're a very high stress occupation. A high proportion of dentists never reach retirement age. You wouldn't think it, would you? Is it looking in people's mouth all the time? We didn't know what it was anyway. So I got called in this November. I said, you want me to come over soon? They said, yeah, how about tomorrow? As I'm looking out my window and it's pissing down rain, as it usually does in Manchester. So I went off and did a study, but this was the BDA study, and look what we found. It was all the people problems. Nothing to do with looking in people's mouths, standing up, managing difficult patients, coping with difficult patients, trying to manage a practice, administrative duties, trying to get balance between my work and home life, and patients perceiving them as inflictor of pain. I love that one. These were all predictors of ill health. So what's the implication and what's the impact? You train them to deal with people. People don't like going to dentists. So you have to manage their fears of going to a dentist, and you have to manage that relationship. So it was about social skill development, and that's what they started to do as a consequence of that. So it pays off. It's not just a fun study that I publish. It has impact. Relationships at work with boss, colleagues. I think this is really kind of pretty fundamental. The most important relationship all of us have is with our line manager. So every one of you buggers who has people working for you, you're the most important thing for them. You will create an environment which they will be healthy in, thrive in, be motivated in, or stressed. You'll burn them out. In fact, for most, and by the way, this is the big issue. I run something called the National Forum for Health and Wellbeing. I run it out of Manchester Business School, but actually it's made up of 37 major employers: Shell, BT, BP, Microsoft, the UK government, the NHS, very high level HR directors and chief medical officers. We meet quarterly. We have no funding, except they give the university a certain amount of money, so I can have 1 day a week person to run this outfit. When it came to us, and these are all top people and top employing tens of millions across the world, all right? When we meet at one of the headquarters every quarter, last one we met at Rolls-Royce, it's one of our sponsors, I said, when we started 3 years ago, I said, what is the most important first issue you want us to explore? And I'll bring in the right academic to review the evidence, and then we'll decide what we're going to do about it. The line manager. The boss is the person that damages people the most or makes them thrive. And the DWP are now looking into that, have a committee. My forum is working with the DWP on what do we do about line managers. And the way we do it now is almost everybody, particularly the academics, I'm not talking about you because you're professionals. You take an academic, you become a professor, and then we say, now, can you manage that group? Right? Of course, we give them 1 day training, or we put them on a senior leadership program for 4 or 5 weeks. 1 day a week or 2 days a week or something like that. But that's all we do. We promote people on the basis of their technical expertise, not on the basis of their people management skills. Really, every workplace should have you know how you have in a packet of cigarettes says smoking is dangerous to your health? We should have a sign that says your line manager or your boss is potentially dangerous to your health on the door of every goddamn workplace in the UK. And the evidence is that is true. It's because we don't have line managers who have EQ, emotional intelligence. And we don't appoint them on the basis of that. We appoint them on the basis of their technical expertise. That is a real UK problem, probably the most significant problem to the lack of our productivity in the UK. Anyway, so relationships. My last quote from Heller, I just love this one. This is why I bought the book in the first place. Opening paragraph of the book. And Heller worked in an insurance company before Catch-22. So listen what he says. Opening paragraph. In the office in which I work, there are 5 people of who I am afraid. Each of these 5 people is afraid of 4 people, excluding overlaps, for a total of 20. And each of these 20 people is afraid of 6 people, making a total of 120 people who are feared by at least one person. But I love this bit. In my department, there are 6 people who are afraid of me, and 1 small secretary who's afraid of all of us. I have 1 other person working for me who's not afraid of anyone, not even me, and I'd fire him quickly, but I'm afraid of him. The thought occurs to me that there must be male clerks, assistants of all kinds of ages who are afraid of everyone in the company. There's a typist in our department is going crazy slowly, and we're all afraid of her. Her name is Martha. Our biggest fear is she'll go crazy on a weekday between 9 to 5. We hope she'll go crazy on a weekend when we aren't with her. Now, it's humorous, but it's about relationships. And I think the relationship to the boss is probably the most important relationship. I'm not saying colleagues isn't. Sure, it's important. But the science shows, and there's tons of study on this, your management style creates the right kind of... There's a University of Manchester culture. There is a faculty culture. There is a department, probably not a faculty culture as much. There are some differences. There's definitely departmental cultures, like Alliance of Manchester Business School has its own culture, right? And then whatever your role is and whoever you deal with, that's another microculture, probably the most important culture, incidentally, except that the top culture, i.e. the University of Manchester, can sometimes get in the way of you being able to do what you want to do. And that's why we're looking at the whole issue in the university of values and how do we change, and that's what Patrick is very keen on, how do we change the culture here so that people feel more engaged, so that if they feel better about their job and more job satisfied, that'll go down to the students. Believe me, it will go down to the students. So I think that is, if there's no takeaway, the most important thing is the role you play. And managing people by praise and reward and not fault finding is another one. You know if somebody cocks up that you're going to get at them. But when they do a good job, just saying to them, hey, that was really a good job, thank you very much. It doesn't have to be with money. It's just that there was an American Airlines did something really interesting. They did their employee survey, and the employee survey found that people said, nobody recognizes anything I do in this organization. That's overall what they found. So the HR director said, here's what we're going to do. We're going to give every manager $50 vouchers. Typical Americans, they do everything with money. We're going to give them $50 vouchers, and every time somebody does a good job, you're to go up to them and say, that was a really good job. Take your partner out for dinner. Here's $50. That was a number of years ago, $50. It'd probably be $250 now. But you get the message. But it wasn't about the money. It was about alerting. And they had to get rid of those $50 things by the end of the month. Right? And the whole purpose is to make them aware when somebody is doing a good job. Right? They did that for about 3 months. And I think it was a kind of a worthwhile exercise. Just to recognition is important. Career development, over promotion, under promotion, job insecurity is big, in lots of organizations. I think universities used to be relatively secure, but like every public sector body, people do lose their job now, and we, underperformance does lead in most organizations. Certainly I do a lot of work in government with government departments, and civil servants are no longer secure anymore. So, and Brexit, I'm not going to mention too much about the B word at all, other than please vote for revoking Article 50 and bloody quickly. Anyway, no, sorry about that. I don't mean to overdo this. I think we have a problem with Brexit. Funny enough, next Wednesday, I'm going out to French 24 because a number of us have been doing study. We call it Strexit. That we think that we know from a psychologist in the country, we're doing a book on this too, that the level of job insecurity as a result of Brexit is very high, particularly in certain sectors. Think about the finance sector, could go to Frankfurt. Think about manufacturing, car making, and we're seeing a lot of job insecurity as a consequence of that. So job insecurity is there. We saw it during the recession. This is CMI study of all employers in the UK, Chartered Management Institute. And you can see during the recession how the insecurity levels rose quite dramatically. We're seeing that now. It's only because of uncertainty. When you don't have certainty, this is what happens. And during the recession, I love this. This came from the Buffalo News. Boss says, the bad news, Johnson, is you're being let go. I don't know if that's the boss or that's HR department. The good news is you can have your old job back at half your former pay. I can't live on that. The rest of the good news, we can offer you a second job, also at half your former pay. At the bottom says, I'd offer you a third, but I'm afraid of overheating the economy. So this is an issue, you know, levels of job security and everything else. I think it's generational because I notice with my kids, they're not worried about it. They just, the world for them is intrinsically insecure, the world of work. They just know it, right? I think it's for 45 and above where it's become a kind of a big issue. Organization climate, this is important. You create that climate, each one of you in your little bailiwick. The university creates it, and we have to create the right kind of climate. This is just one more Heller, because I love this one too. This is just a one-liner. So in his book, this person says, I always feel very secure and very superior when I'm sitting inside the boss's office with the door closed and other people, perhaps Cagle or Green or Brown, are all doing the worrying on the outside about what's going on the inside. It's quite a nice little vignette. So culture is important, work-life balance, big issue. It's quite interesting how in universities, I don't know, do we have really, do many of you work flexibly? How many would you say work flexibly? It's not very big, is it? Because it's really becoming a big issue now, flexible working. A lot of people want to do it. And universities should. But who does work flexibly is the academics, don't they? Huh? You don't know where the hell they buggers are, do they? Okay, particularly when it's 24 degrees outside. But this is quite a big issue. How do we balance life? We have the technology to be able to do that, and I think it is quite important. So those are some of the main factors, and they are, oh, by the way, there's one other factor, which is a more contemporary factor, which is this. Do you know what this is? Okay. It's a mobile phone. Now, I know you live reasonably lives, you look after your own well-being, which is really good, and I want you to do that because this is my university and I want you to do well. But let me ask you a few questions, okay? Hands up on this. How many of you access your mobile phone at night for work? Bad news. How many of you access your phone the first thing you wake up in the morning looking at your workplace emails? Now, this is the worst question of all. How many of you do it when you're on holiday? Oh my God. Karen, Patrick, we got to talk. That's just not good. Do you know what Volkswagen do? They block the emails at 5 o'clock every day, a working day. Do you know what Daimler does in Germany? They block it when you go on holiday and delete any emails you get while you're on holiday. How do you like that? Do you know what the French law is? No manager in France can send an email out of office hours to their subordinate. It's against the law. That's a national French law. So I always said, well, it sends a good message, but it's unenforceable. Guess what happened? 2 months ago, a British company operating in France, Rent-A-Kill Initial, the merged companies Rent-A-Kill Initial, they were fined 60,000 euros for breaking the law because their employees complained to the French government and they were fined 60,000 euros. And it was all over the French press. So it made them look really bad. The point I'm trying to make is I don't want to do particularly, and I think we ought to experiment with this, by the way, in this university. And I have a PhD student from Germany who's over here doing a PhD with me, who's doing it on email. And I'll offer her up for the university if we want to experiment here. If people want to work flexibly, then it can't be shut off at 5 o'clock, can it? So say one of you wants to go pick your kids up at school, or go to a sports day, or you want to do something, you want to work at home in the afternoon for whatever reason, right? You might then do your work at night. So blocking it's not a good idea, but at least it sends a message that this is interfering with our health. The evidence now, and it's a whole field called technostress, and I've published about a half a dozen articles on this already with PhD students I had when I was at Lancaster. It does damage your health and damages your family relationship, that this constant being on, right? So we have to kind of control it. And my PhD student is going in to take a look at trialing things like don't send an email. So I'm at Manchester Business School. I should not really send an email to anybody in that school. I should go talk to them, eyeball to eyeball, right? Because number one, you get a lot out of that. And number two, if I send an email, then they send back for clarification, and I go back. And how long does that go on for? And then the CCing in is covering your backside? Huh? Everybody's in. Patrick's in. Nancy's in. The whole goddamn world is in on a CC. That does nobody any good. So we have the National Forum for Health and Wellbeing came up with a 3-page guidance to organizations, which is now used by a lot of members of my National Forum, which says, CCing only people that count. A manager, never send an email out of office hours unless absolutely urgent. Never send an email on a Friday afternoon where you say, ignore this until Monday morning. Sure. Right? So we have guidelines now on what's appropriate behavior. The irony is, of the 37 companies I had in, I said, when they said this was an issue, by the way, it came from them, and this is an issue we need to tackle. Only one of those companies actually had guidelines. None of them did. And it included the NHS, because we have the NHS, chief executive of the NHS management. So we had public sector bodies in as well. Okay, so interventions. What do we do about all this? We have the equivalent of EAPs. We have a counseling service. EAPs, Employee Assistance Programs, is a counseling service. We train people on resilience training, We do training, and that's fine too. That works. But what we also need is, what most companies are doing is saying, what are our problem areas? Well, let's find out from employees how they perceive. This is not the employee survey, because they're rubbish. They only very, very highlight big problem areas, but they don't go underneath it and find out how the individual feels. Do they have a good day at work or not? What ruins their day at work, or what is a really good day at work for them? What are the factors that make that happen? So most organizations now in the public and private sector, big ones, do well-being audits. Easy to do. My University of Manchester spin-off company, we do that done it with tons of companies, including the one that built the Manchester Business School. Mace is a big client of ours. They're a big construction company. They're the ones who did Tottenham Stadium, and they're doing Euston Station now. And I've been to their board meeting twice for a whole hour on well-being. This is a construction business. We should be ahead of the game, particularly the university sector. My university spin-off also works with other universities too, but public and private sector. But it's that kind of approach. Train the individual where they need help, resilience training or whatever, management training. Identify the people who should be line managers based on their people skills, not just their technical skills. When we recruit anybody, we should have that as parity with their technical skills. If they don't have the people skills, then they shouldn't get a management job. Or they should be trained, extensively trained, not a one-day job. So that's a kind of strategy. CIPD just publish, and we publish an annual good work thing. The evidence that we've mounted from all our HR directors of all the public and private sector companies, these are the results. The results are clear. PwC, 55 companies evaluated well-being interventions. They have to be strategic. Here's our problem. Our problem is this. The problem is everybody now sees well-being as a bottom line issue for productivity reasons, for sickness absence reasons, for all of that reasons. So they kind of know it's important, but what they do is what I call low-hanging fruit. So what they do is they say, well, let's do mindfulness at lunch. That's a good one. Let's do sushi at your desk. That's in the City of London. Actually, the finance sector is one of the most advanced sectors. You know why? Because during the recession, what happened? They lost 40% of their staff, between 30 and 40% of their staff. They were so mean and lean. They said, HR director, I said, you buggers did nothing during the recession, before the recession on health, well-being, trying to create the right kind of environment, culture. And he said, we're doing it now. And he said 2 words. He said, the reason we're doing it is regrettable turnover. And I said, I've got to write a book on that because that sounds great. I said, what is it? And they said, we are so mean and lean, we can't afford to lose any key people. We lose them, it meant labor turnover. We lose them, we're dead. If another bank takes somebody from investment banking business, we're in trouble. So it's talent retention. By the way, that's us too, right? We didn't manage 2020 very well. I'll just say that because I'm just making an observation. We managed it very poorly. We lost good people because we managed it poorly. And we have to now learn from that and figure out what we're going to do now to create, and I think that what Patrick and Karen and other people are on to now. What are we doing creating the right culture? Anything we do from now on, we have to engage people in it rather than impose it. Right? And so that, I think, is kind of fundamental. But you can see it works. The evidence is overwhelming. The bottom line, not just a nice fuzzy little concept, fruit, at our desks. It's not that at all. It is much more strategic, and it's by lots of companies out there, and public sector bodies are making a strategic, planning a strategic well-being plan for them for the future, not just these funny little bits and bobs. Nothing wrong with mental health first aiders. I think we have them here, don't we? Mental health first aiders. That's fine, but it's not the answer, right? And one of my PhD students, by the way, is evaluating mental health first aid in an organization that's in a big communications organization in Salford. You know that one? I frequently talk to them. I just did a few interviews for them, and we're looking at does that work? Does it help? I actually think it helps the people acting as mental health first aiders than it does the recipient. I think it helps probably both, but it's part of a strategy, but that's not the strategy. By the way, why employees begin to sue more now their employers for stress at work and go to the HSE is because NICE actually, as far back as 2009, came up with guidelines on stress and well-being. And if you break those guidelines, you can go to the HSC with this data. So there's a bit of litigation in it. I don't want us to do that. I want us to be proactive and do good things. These are just some of I'm not going to use it. My company has done network rail. We had a big project with all the people working on the line. The guys at the coalface, repairing things. It was really interesting. When we did this study with them, I'll show you what we did. I'll just show you how we measure it and give them the hard data. We give them the hard data. We found, and we were looking at 2,600 people, roughly about a 10%, a little bit under 10% of the whole population, 10-15% of the whole population of network rail. We found that if you introduced psychological well-being, and we had a specific thing we did with mobile phones, it's really interesting. That and we could measure their productivity because it's a clear-cut way of measuring it. We found the correlation was 0.46, very significant. So then what we did, and we've looked at the high well-being, the high productive people and low productive people, and a big difference in their well-being scores. Then we created a formula on what would this cost. Let's see how much we would save. But being a university spin-off company, and you're trying to collect data to show them this is bottom line. We then found that what we saved with network rail was £1,201. Doesn't sound like a lot. That's for each individual working for them. If we took only 15%, it would save 468. It saved 468,000. 15% of the total company's workforce saved 1.6 million. If we did that in the UK and only improved it by 15% of the staff, that's all. Is that being conservative? That's being conservative. We saved the UK 5.6 billion, which would pay for 243,000 nurses, or 21,500 Lamborghinis. But you get the message. And funny enough, in the old days, we used to have to prove this, that when we do intervention, we should do that, by the way, because some interventions just don't work. It could be that we find out that mindfulness doesn't actually produce any benefit, really, in the long run in terms of sickness absence or productivity or anything, right? It may be nice to do it and lie down and meditate, but it may not actually hit either an individual bottom line or an organization bottom line. It's important we know that, so let's dispense with that and let's go on to something else and see what the impact is. But this is not what well-being is. Tomorrow is this is the boss. This is you. Tomorrow is the mandatory meeting on employee health and well-being. The meeting starts at 6 a.m., so it'll interfere with your sleep and not your work. Doesn't that send a message that work is more important than health? I hope so. That's the theme of the meeting. Healthy employees are unproductive. They're always exercising or eating fruit when they should be working. We prefer employees who work hard and die before their pensions start paying out. Suddenly I feel sick, right on schedule. Okay, so I'm just going to read one more thing, and then I'm going to have you do an exercise. Is that right? Yeah. This is the boss over here. I listen to him. He's my boss today. Listen to this. You think well-being is new. It's not a new concept. Listen to this. There was a guy called Bobby Kennedy. Do you remember him? Okay, he was the best president the United States never had, right? He was assassinated, unfortunately, in my hometown of LA. He did a speech a week before he was assassinated at the University of Kansas, and he called it gross national well-being. At that time, all economies measured gross national product. We call it GDP now. It's, in other words, everything we produce, from services to products, aggregated all up, and that's the wealth of the country. And he was arguing that doesn't tell you about how good our society is. Listen to this. I'll read just a couple paragraphs. Too much and for too long, we seem to have surrendered personal excellence and community values in the mere accumulation of material things. Our gross national product now is $800 billion a year. By the way, this is 1968. That gross national product, if we judge the United States of America by that, counts air pollution and cigarette advertising and the ambulances to clear our highways of carnage. It counts special locks for our doors and the jails for the people who break them. Remember, this is Vietnam. It counts the destruction of the redwood and the loss of natural wonder in our chaotic sprawl of our cities. But it counts napalm, which they used in Vietnam, and counts nuclear warheads, which we still produce, and armored cars for police to fight the riots in our street. Yet the gross national product does not allow for the health of our children, the quality of their education, or the joy of their play. It does not include the beauty of our poetry or the strength of our marriages or relationships, or the intelligence of our public debate, or the integrity of our public officials. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except that which makes life worthwhile. Is that amazing? And I don't know if you knew, the country of Bhutan does not measure GDP. They measure gross national well-being. And there was a Bhutan Declaration 8 years ago that went to the United Nations, at which Britain signed up. 89 countries signed it, saying that we should not be measuring GDP. We should be measuring GDP as one component of gross national well-being, but only one component. We haven't got there yet. That was 8-9 years ago, and it hasn't changed. So well-being is not a new concept, but it's something that you're in charge of, not for the whole damn university, but for the people that you're involved in. And just think about that. People, you create the culture, and you're the ones that can change it, and you can do it from bottom up. The university also has to get its value system right and has to create the right kind of culture, providing more autonomy, less control, command and control. That's the kind of stuff that has to come from the center, but you have a lot to do with your own people. Thank you very much.